Yeah, dipping your male bits into hot water. Is that okay to say that?
It is now.
We're starting a new series called DocTalk, where we discuss current events and what this might mean for you. From research and studies to pop culture and everything in between, we're going to break it all down. This series is for informational purposes only, of course, and it doesn't constitute as medical advice. So, if you have any concerns or questions, please reach out to your physician or other qualified healthcare provider. The series is starring Chief Medical Officer of Progyny, Dr. Janet Choi. Dr. Choi is a double board-certified reproductive endocrinologist and infertility expert, and she's in conversation with Progyny's own Selena Yang to discuss a new movie that just came out in theaters called Scrambled. For those unfamiliar, Scrambled depicts what it's like for a woman in her mid-30s to freeze her eggs. The movie follows Nellie through her journey, and hilarity ensues as she goes through the egg freezing process. And today, we're going to get Dr. Choi's take on it. Enjoy today's Doc Talk.
So there's actually a new movie that just came out. It's called Scrambled, and it's interesting because the main character, Nellie, is also the producer and the inspiration for the story. And it really follows someone in her mid-30s. This is going to sound familiar. In her mid-30s, and she comes to this realization after going to like weddings, bridal showers, baby showers, insert other fun showers for her friends, and she finds herself of a little bit unsure of where her future is going to go. And there's this great scene where she's like at a wedding, and her friend essentially says to her, like, "Are you going to freeze your eggs? Like, how old are you?"
I almost fell off my chair when I saw that scene when her friend, who looked so perfect on the outside, right? And then just totally unpacked everything and then smacked her in the face. I thought it was hysterical.
I also agree with you on that. I think it's that part's in the trailer because it's so good. Yeah. But I am curious because this, in my mind, this type of movie, it's meant to be more of a rom-com. It's lighthearted, but it's serious at the same time. When you watched the movie, one, I'm curious of like your overall gut reaction, but also there are some medical like scenes in it. Like, how accurate are those scenes?
Most of the scenes were actually spot on. So, for instance, one of the first times when she is visiting the doctor for initial consultation, and she's sitting and looking very uncomfortable in a waiting room that's packed with women. Unfortunately, that's how doctors' offices can be, especially for fertility centers, because everybody is trying to get in the door, get monitored, get seen between 6 a.m. and 11 a.m., and then get back to work or whatever they're doing with the rest of their life. And you can feel like patients have sometimes complained to me that it feels like a cattle call. But yeah, so that actually was very accurate. The deadpan manner of the doctor and how he delivered some of the news was also very accurate. But I also want to just make this point really clear. He told her, and she was despondent afterwards, that she had decreased ovarian reserve. It just means her egg supply seemed a little bit low based on the ultrasound he did. I'm guessing he also probably behind the scenes did some blood work, like something called an anti-Mullerian hormone, AMH. We all know what that is, right? But understand, super crystal clear, I want you to like put this in the back of your mind and like pack it away. Being told that you have decreased ovarian reserve, especially if you haven't been trying to get pregnant and don't have any fertility issues, you're just doing a consultation with a doctor because you're like, hey, should I be freezing my eggs for the future? Having DOR does not mean that you're doomed to have future infertility. So for me, that's really, really important to understand.
And in general, it feels like, at least in the last couple of years, we're seeing more stories, more just portrays of egg freezing in general, whether it's part of, you know, the storyline in a reality TV show, if it's part of, you know, a scripted TV series, a movie like this. Why, in a way, do you think there has been more talks about egg freezing in general?
I think for a variety of reasons. So from a medical perspective, so as a doctor, I want to just give you some of the data or the science. The rate of infertility is increasing, and unfortunately it does increase with aging. Stark fact, the WHO released this statistic last year. 1 in 6 individuals worldwide will have infertility and the struggles to conceive a family on their own. And that rate definitely increases unfortunately, as a person's eggs and ovaries age. Although, like I said before, it doesn't necessarily mean that you're guaranteed to have infertility if you're over 35, for example. So that's the science and the medical knowledge that's more widespread and understood, I think, by lay people. The technology, the medical care, the science behind egg freezing, and the efficiency of how well those frozen eggs work when they get thawed out and can lead to potential pregnancies in the future has greatly improved over the past few decades. And companies like ours, Progyny, I think, like I've told you, I think we're the OG on this, right? Mm-hmm. That we are helping make things like egg freezing, because it's a pretty expensive medical procedure to go through. As we saw in the movie, she had to beg her annoying brother for money, right? That it's hard to cover the cost for most people. So having the benefits more readily available through the employers makes a big difference. So I feel like more and more women are accessing those benefits to try to help themselves in the future.
Yeah, absolutely. And it's funny because she, in the movie, also Googles how to make money quickly, benefits or companies that cover egg freezing, right? So I think that was, it portrayed the reality of what I think a lot of women are going through. And also the reminder that this is still a serious procedure. And it shouldn't be taken lightly, right? And they should really talk to their doctor about if it's right for them.
100% agree. Yeah. And I also like how she injected humor to something that's very, very real when she was doing a fire sale on all of her handmade jewelry. I've seen, unfortunately, people who've taken second loans out on their houses to try to afford fertility preservation. So it's really heartening to see that more and more employers are looking to try to offer this, in my opinion, really necessary coverage for all women.
Yeah, absolutely. What is a common myth that you are still hearing today?
So myth number one, if you decide that you want to do an egg freezing cycle, it doesn't mean that you're going to deplete your egg supply faster. That's one of the number one questions I get asked over and over again. Well, if you pulled out, Dr. Choi, 15 eggs last month, does this mean I'm going to hit menopause at a younger age because you depleted my egg supply? And the answer is no. Again, normal biology, you lose lots of eggs per month, just like we lose lots of skin cells every day just by existing. So going through a cycle or 2 or 3 of egg freezing, if you decide that you want to do that, does not accelerate the aging process at the level of your ovaries. That's myth number one, just to fix right there. Myth number 2, having 10 eggs in the freezer doesn't mean that you're going to have 10 babies waiting for you in the freezer. And again, I try to make light of that and yet also give people a reality check because there is there's a step-down process. Not all eggs behave well. They don't always survive the freezer. They don't always fertilize or turn into embryos or pregnancies. So although it gives you an added cushion, an added insurance policy, it's not 100% guarantee of a baby.
I was hearing another doctor saying no, I'm not taking away, you were going to shed them anyways. I'm just rescuing them.
Yeah.
I was like,
I like that.
Yeah.
It's take my egg and can you rescue it?
Yes.
This freezer, yes.
And put it in the freezer for later.
Yes.
So, yeah. And then my last question on this particular film is, what should someone really keep in mind when they are thinking or about to embark on an egg freezing journey?
It takes some pre-planning, and ideally, if you have the social support, that's really important. You saw in the movie, I saw in the movie, and I like how it depicted how she was trying to clean up her act. She threw out all of her liquor bottles. She was trying to eat more clean. It is a medical procedure, and if you want to get through it safely, you want to try to optimize your health before you go through the process and through the process. So think about, if you're working or if you're a student, is there a pocket of time for a couple of weeks where maybe you won't be as busy schedule-wise, where you won't have to be hopping around the country for work trips, so you can stay in place, see your doctor for the routine care, and if you need, emergency care, for emergency care as well. One thing I wanted to sort of comment on the movie, although I found it hilarious and more power to her, doctors will typically tell individuals who are freezing their eggs not to engage in sexual activity, sexual intercourse, because one, you don't want to injure your ovaries, cause them to move and twist and cause a lot of pain as they're growing in response to the fertility drugs you're getting to wake those eggs up for your egg harvest. And you also don't want to accidentally get exposed to some sort of infection along the way that'll complicate your surgical procedure. We do tell patients it's totally fine to do things like masturbate, to snuggle, to have a date night, but just to kind of avoid that until at least a week or so after the procedure.
A week or so.
Yeah,
Yep.
just to be totally safe.
Absolutely. No, it's good PSA, actually.
Yeah.
I think someone could totally watch that movie and be like, oh, that is totally okay.
I'm like, no, just to be, and actually most patients, even though I counsel them this, will say to me, I don't even feel like going near anyone for a couple of weeks, so this is fine that you told me, but I wasn't going.
Right, because you're bloated.
Yeah.
You're
Just whatever.
a little imbalanced. So, in general, I've seen more stories around male fertility, which is still, it's an important topic to address.
Absolutely, yes. Significant proportion of infertility is caused by male fertility issues.
But I think maybe it was one article in CNN that talked about menopause. And I take it lightly because it's like menopause is having really a great moment in the sense of people are really finally addressing the problems with like menopause. And I feel like, women are getting a good spotlight, and then terming like menopause, like I was like, oh, did we? Well, I'm have to do that, but I mean,
You said it, I did it. I'll give you my facial expressions, but yes, okay.
So I am kind of curious, is there such thing as menopause? Is this a term that we should be using, or should we be just talking about as like male fertility?
So I put them in two different categories.
Okay.
Male fertility, again, correct me about the statistics because I'm terrible with numbers. I think about of all the couples who see a doctor for fertility care, at least 30% have a male fertility component, and maybe higher in certain situations. And so that's why we always try to do we request that if there is a male in the partnership to do a sperm test. But when it comes to, I can't even say it, you said it, every woman who is fortunate enough to be able to live into her 30s, 40s, 50s, 60s, and beyond is going to enter menopause. Menopause is a discrete event. It's a moment in time when a woman has not had a period for 12 months, and that's considered menopause. And no other hormonal or medical condition to explain that, like hypothalamic amenorrhea. I'm going to throw out some jargon. You can Google it later if you want. Menopause happens to every single woman who enters those decades of life. Changes in male hormones, or andropause, as some reproductive urologists will term it, does not affect every single male who ages uniformly. What is well known is, as men age, aging does cause changes in the body, like a decline in testosterone. And that can lead to things like decreases in energy and potentially decreases in sperm quality as men enter their 40s and 50s and 60s and beyond, but not across the board. So I do think it's a little unfair to put into the same bucket and actually, in my opinion, divert the spotlight away from a much needed medical condition that needs to be addressed properly, which is menopause for women. So that's why I was so excited, especially in 2023 when we started our partnership with 2 expert providers in the field. So the answer is no, it's not in the same category.
Yeah.
Did that answer?
No, it did.
Yeah.
No, and so you did mention age as a factor for how it can impact one's male fertility. What are some other factors that can maybe impact for like low fertility? For maybe someone who's like trying to conceive.
So again, tips to consider that you can sort of pay attention to, make changes and adjustments without having to even consult a doctor. Lifestyle. So, I always harp on trying to maintain a healthy body mass index. Men who are overweight or obese causes a disruption in their hormones. They're actually making more peripheral estrogen, which can then lead to poorer sperm quality. And that's actually reversible through adjusting diet, exercise, adjusting one's BMI over time. So lifestyle issues when it relates to BMI and healthy eating. Different social habits like alcohol consumption, marijuana, other substances. A lot of men, because they're building up their muscles, are using anabolic steroids. All those factors actually can do awful things to sperm quality and male hormones. So those are other things to be taking a really kind of honest look at to say, if it's really important for me and my partner to try to build a family, what kind of changes can I make before I even consult a doctor?
What should they make those changes?
Today. So basically, infertility, if you go through look at the old school definition, which thankfully ASRM has adjusted to make it much more inclusive as of last year. typically was defined as like how many months has a heterosexual couple been trying to conceive on their own before they go see a doctor. And usually, depending on the age of the female partner in the relationship, it's either 6 months of trying to conceive TTC or 12 months if you're under 35. And so what I'd say is out of consideration to your partner, if you have a female partner, if the two of you are already having conversations about family building, start looking at and making lifestyle changes now. So hopefully you won't have those problems, and hopefully the two of you will be able to conceive really efficiently without seeing a doctor.
Yep.
Right? Oh, hot tubs.
Yeah. Yes.
Not the time machine, but hot tubs. So that the immersing one's lower bits into hot water actually can temporarily, dramatically lower, if not even just kill off all of one's sperm. Again, over time, your testicles will make sperm. Don't worry, they'll come back, but it can take months. So again, if you know that you're on the track of like trying to build a family, you may also want to avoid that kind of hot tub immersion, at least short term.
Do you feel, is that the same with saunas and steam rooms?
That's a good question, and I don't think it's the same, because that is more like environmental climate heat exposure as opposed to
Going right in.
dipping your male bits into hot water.
Yep.
Is that okay to say that on air?
It is now. So there was a recent study that came out of University of Los Angeles that essentially examined the impact of COVID and how it impacted babies in utero and if they had any respiratory distress. And then there was another study that you had sent me about I think babies going to full term. It came from like Norway and Sweden. I believe.
So again, I actually really appreciate you bringing up that first article because I think you had found it in a news feed and I looked it up. So it's really interesting. Again, I am a big proponent. I think if you talk to the vast majority of primary care providers, OBGYNs, maternal fetal medicine specialists, pediatricians, any doctor worth their salt is going to say the COVID vaccine is safe. It is safe to get whether you're trying to conceive or not. It is safe to get at any point during pregnancy. It does not cause harm to the neonate. So that massive study from Sweden, Norway, where they looked at like close to almost like 90 to 100,000 newborns, because some people were sort of grumbling that, could the vaccine cause more harm to the neonate, so the newborn, if the pregnant mother receives the vaccine. And they were showing actually lower rates of health complications than those newborns, lower rates of preterm delivery, lower rates of brain bleeds, right? So, and another question that's come up separate to that, and I'll address the UCLA, which I thought was great, is a question I got a lot as a fertility doctor is I don't want to get the COVID vaccine because it's going to mess up my cycle. No, it will not. At most, it might possibly throw off your menstrual cycle by 1 day. There's, I think, a study. For maybe a month, but in most cases, not even that, and it does not affect your future fertility. In fact, I would worry about someone not getting the COVID vaccine, getting super sick with COVID, having a high fever, and that could actually do transient bad things to your sperm count and quality in the male partner, and it's just not good for your health. In that UCLA study, what they found in this population, they studied of about 220 some odd pregnant women, were that all of these pregnant mothers in pregnancy got COVID. The women who were not vaccinated got COVID. Even though all the newborns were tested and they were negative for COVID at birth, those newborns whose mothers did not get vaccinated had significantly, I think 3 times higher rates. Yeah, it was pretty impressive. 3 times the rate of respiratory distress post-birth. Scary. Whereas the mothers who got vaccinated and got COVID and then had delivery, those babies had a significantly lower rate of respiratory distress. So it's not just for the pregnant mother, it's also for the health of the newborn. It is so important to get COVID vaccinations.
I couldn't agree more. Right. Personally, I already got my whatever latest version of the booster that is. And we'll also have both of the studies and the articles in the show notes for anyone who is interested to take a read for it. Yeah. And there is a myth, and this kind of goes into some of the myths that you've heard or maybe concerns patients have about like the COVID vaccine and those who are either expecting or looking to conceive, is the myth of, does the vaccine cause a miscarriage?
No. I mean,
Yeah.
was that rude?
No.
I mean, like, no. All right?
Yeah.
In fact, my concern is that anytime a pregnant person is sick with a major infection, high fever, I actually worry about that high fever and that protracted illness, like bad COVID, leading to a higher rate of miscarriage. So, no. Can I say that again? No. Just get the COVID vaccine, please.
That was helpful. Thank you. That's actually all the stories that we have for today. So thank you, Dr. Choi, for
you, Selena.
sitting down with us and breaking down those stories and giving your expert insight.
Thank you so much. This was a lot of fun. When are we going to do this next?